I had been unhealthy for several years, but actually began to really feel unhealthy probably about the fall of 2015. I was starting to have symptoms that I had begun to realize that I think this is the onset of diabetes. So I made an appointment with Dr. Beck.
Cliff was in a bad way. He had uncontrolled diabetes and his weight was quite high. And there was a cascade of other metabolic things that went along with that, high blood pressure and cholesterol, you name it.
I was basically killing myself slowly with food for several years.
And very bluntly, I approached him with the numbers and I said, Cliff, this is a problem. Tell me about how we got here.
Food had become the crutch that I needed to sort of deal with life and deal with stress. It was really easy for me to be sedentary at work and then come home and be sedentary at home. I mean, I even have a sedentary dog, and that just compounded until I was a full-blown diabetic.
His fear was that he would not be able to interact with his grandchildren, his wife, his family.
I need to do something about this because I'm really too young to have parts of my body amputated and then eventually die from this disease.
He wanted to change. He did not want this to be the status quo in his life.
Diabetic patients that really need help and need assistance, we can hone in on who those patients are, what measures they're not meeting, who they're attributed to in terms of the primary care physician.
Since we've initiated our whole population health healthy registries project, really brings to light patient gaps in care.
Our mission is to improve the health and well-being of our community, and our vision is to become the healthiest community in Wisconsin.
Jefferson County has moved up from 33rd to 8th out of 72 counties in Wisconsin.
We're going to go all in on this particular issue to keep people out of the hospital.
I think everybody's in it to make sure that everybody really is as healthy as they can be.
We've got a very active pediatric wellness team who are really passionate about childhood obesity and wellness in our communities.
Other chronic conditions we're looking to impact, diabetes is high on our list, heart failure, hypertension, COPD, asthma, a whole host of chronic conditions.
We're not working on just the electronic medical record anymore. Now we're working at it from a community perspective.
Over time, we've learned what our patients are all about, and just our overall mission vision has been driven now by the data that we have within Cerner.
I'd say the biggest area of improvement is the way that we're able to engage our providers.
Having a comprehensive quality electronic health record allows us to say, we really are the healthiest community in Wisconsin and we are going to prove it to you.
And now with the data, they can see it. They're partners. They're helping us move that data forward.
Our patients who have diabetes, they're coming in for those needed services. We have multiple ways now to reach out to patients and quickly identify those patient needs.
So Cliff and I interact primarily electronically through this portal, or this basically an email program linked to our electronic medical record, our EMR. And Cliff will send me an email when he's out of work, and I'll get that email the next day and I'll send him an email. He'll check it later on. So what it does is it kind of facilitates an easier form of communication.
It's nice to know that my doctor is looking after me even though I'm not right there in front of him.
We're more proactive about engaging people kind of where they are, identifying who is falling through the gaps. And we weren't able to do that previously. We were very reactive.
The IT support that Cerner Health provides to Fort Healthcare, that suite of tools that they provide through their portal, it allows for me to be a participant in my own journey towards being healthy.
You can't be a passive participant in your health. You have to be active, you have to know your numbers, and you have to be engaged.
The weight loss is a byproduct of the other choices that I'm making now. I can actually see the results. It's been 8 months. I still have a sedentary dog, but now I do have a little bit more energy.
Making it easy to take care of yourself is really where we need to be as an industry, and I think we're really focused on that at Fort Healthcare.
It's not just about information technology anymore. It's so much bigger than that. So I think big things are to come.